Jake has placed in the chat. And just an FYI, these are recorded and we'll post them. We'll be posting them later. So welcome. We appreciate your patience as we work through some of the communication channels that are going to work for everybody via email, trying to get those reminder outs to y'all. So we just wanted to let you know that. We're going to start off with a little bit of an introduction quickly to our MCH extension state team. So these are going to be the folks that you're going to be hearing from the most and that are going to be involved with the learning community calls. Christina, can you go to the next slide, please? So I am Jen Braun. I'm the health equity specialist for the Institute of Health and Wellbeing here at UW Extension. And my work on this project is going to mainly revolve around the pieces that have to do with working with youth and coaching around youth development and engagement. I'm going to pass it over to Debbie.
Good afternoon, everyone. I'm Debbie Mullendorf, and I'm a health and wellbeing educator located in the northern half of Wisconsin. And I am primarily, my role with this project is going to be to try to connect you with county extension educators throughout the state as you're working on projects for assistance and their involvement in projects. And I'll hand it to Danette.
Great. Good afternoon, everyone. My name is Danette Hopke. I am the brand new behavioral health program manager, and I will actually be the project coordinator for this project. So I am literally just getting my feet wet in all things program manager, transitioning out of a county-based educator role up here in Washburn County in northwestern Wisconsin. So I'm really excited to be a part of this team and a part of this project, and I look forward to working with all of you moving forward as well. And I'll pass it to Jake.
Hey, everybody. I am the graduate project assistant here at the Health and Wellbeing Institute, specifically helping out with behavioral health. So I'll have my hands in a lot of different projects, and this is one of the big ones I'm looking to work on this year. So really looking forward to it and happy to be here.
Thank you, Jake. And Amber Canto, she's our Health and Wellbeing Institute Director, is unable to join us, but she will be also leading some of this grant, providing the leadership around budget materials. All right, so next we're going to go over the agenda. So we have a pretty full agenda today. It is also an interactive workshop, so please plan on contributing to some breakout spaces for all of our like shared learning experiences. We're going to do some breakouts next. DHS, Maggie, they have some updates. We're going to provide a little bit more information about getting to know extension. We're going to talk a little bit about what youth engagement means and some of the future learning community calls and get your opinion on what you'd like to see. And then we're going to do a bit of a research share where we're going to share some resources that we have with you all, and we would love to see what you guys have to share as well. So we're going to start off with some introductions in breakout spaces. So as a reminder, if you're just coming in, please take a minute to complete that demographic survey that Jake has put in the chat. So we're going to do introductions in breakout spaces with groups of 3. We would like you to, go around and say your name, your county, your role, what objectives, if you know what they are, that your health department has chosen for this MCH grant. 4 people per group. And we're going to have 10 minutes total. And Christina will let you know about 2.5 minutes in so that you can switch people. So is everybody familiar with how to ask for help in the breakout rooms? There's a little help button. So if you need any assistance, please press that and one of us will join you. And then Jake also put in the chat what we'd like we all to cover in your breakout space. So Christina, if you could go ahead and break out those spaces, that would be great. Right now. Does anybody want to share something they might have learned from somebody else than when they were in their chat space, or something they learned or met a new person who that was? You can put it in the chat or come off mute.
This is Cindy from Outagamie County. I met two people from Adams County and I forgot the other county. There's one other person who wasn't able to be on because their microphone wasn't working.
Yeah.
But they put the information in the chat.
Well, perfect. Great. Well, we really wanted to facilitate have some space for y'all to work together to get to know each other. We have a lot of communities that are doing really great things, and we want y'all to be able to learn from each other. I am going to pass it over to Maggie at DHS to provide some updates.
Hi, everyone. Just to briefly introduce myself, for those I haven't met yet, my name is Maggie Smith, and I'm part of the MCH team at DHS. I'm the Adolescent Health Coordinator, and I am the lead for the Adolescent Wellbeing Performance Measure. I have been with DHS just shy of 2 years, and before that, I was at a local health department, La Crosse County, for about 11 years. And I have been supporting the Title V maternal and child health work for about a year now. So some of you worked with me last year, but I think I'm a new face to a number of you, and I'm here if you have questions. One of the things that I heard from a number of folks at the end of 2022 was that there were lots of new staff. So just briefly, I'm going to touch on a high-level overview of the maternal and child health block grant in Wisconsin and how that breaks down to the adolescent well-being work that you are all a part of. I'm going to share my screen. So you should see the DHS website here for maternal and child health. I'm going to lift this up as a resource for you if you're looking to learn more about MCH overall. The MCH Title V grant is very large, and this website will really break down a lot of what's happening within that grant. And then as far as how we get from MCH to adolescent wellbeing, each state funded through Title V develops performance measures. So those can be national or state performance measures. And then within the performance measure, we break that down into, and hopefully it lets me just switch tabs here. Are you guys all seeing a spreadsheet? Okay, excellent. So those performance measures will break down into specific strategies. So the strategies for the performance measure related to adolescent well-being, which is a state performance measure, you'll see here on the side, this is state performance measure number 5. And our strategies here, this first one is where a lot of your work will tie in. So this is working with local and tribal health agencies to support evidence-based suicide prevention and mental health promotion programs and trainings in communities, schools, and healthcare systems. So that one's pretty self-explanatory as far as how it ties in. And then we also have a couple of strategies as part of this performance measure that are more of like a systems perspective, kind of cross-cutting work around adolescent well-being. So here we have one around developing youth-adult partnerships to ensure appropriate, responsive, high-quality healthcare for adolescents. And then we have empower and engage youth as leaders in public health, healthcare, and other youth-serving sectors. So we're going to talk a little more about the youth engagement assessment that's part of this work for health departments this year, and that ties into this strategy. And then we get down into collaborating with the DPI to expand and improve upon the youth risk behavior surveillance system, as well as school health profiles, statewide data collection, management, and reporting. So many of you got emails at the end of 2022 about how important it was, particularly with some timeline shifts, to reach out to your school districts locally and encourage them to participate in this, in the YRBS this year. So thank you to all of you for your efforts around YRBS. And then the final one here is just ensuring coordination and collaboration with other partners supporting state level adolescent wellbeing initiatives. The adolescent health team at DHS, we recently completed some strategic planning, and this was by far one of the highlights that came out of that, where all of our partners were like, we really wish there was more coordination between what's happening over here and what's happening in this program over here, and having the state be a little bit better about sharing out some of that coordination and all the different programs that happen at the state level. So this is the action plan. And then the performance measure, so the needle we're trying to move, is specific to some data from YRBS, which is around the % of adolescents reporting feeling so sad or hopeless almost every day for 2 weeks or more in a row that they stopped doing some of their usual activities in the last 12 months. So that is a data point straight from the survey, and that is what all of these strategies and the health department objectives tie back into. I'm going to pause there and just look at the chat to see if there's any questions. Doesn't look like it. Does anyone have any questions about sort of the MCH performance measures, objectives, strategies? Any questions for us at this point? Okay, I'm going to stop sharing this screen. If you think of questions, you can always drop them into the chat. And then I'm actually going to pull up some information about the new reporting process for this year. And Mary is on. Mary, do you want to introduce yourself to the big group?
Yeah, definitely. Hi, everyone. My name is Mary Cush. I am the Title V evaluator and epidemiologist. I'm going to be sharing some information about the new platform that we're going to be using to report on all the work that you all are going to be doing this next year within adolescent well-being. So I'm going to give a bit of an overview first, and then show you what that new reporting system is going to look like. All right. So as some of you may know, some of you may be new and haven't used either platform before. We were using REDCap to track all the activities and work that you all have been implementing within the adolescent well-being objective. We are deciding to move to Alchemer, and just wanted to first give a little bit of background as to why we're making that transition. We heard from a lot of folks over the past few years that REDCap wasn't very user-friendly. It could be kind of confusing or frustrating at times. A lot of users ran into challenges with either creating their accounts or maintaining their login and passwords, knowing how to create records and report their work. It wasn't very user-friendly. It wasn't always the easiest system to navigate. And so we wanted to switch to something that was a little bit more intuitive and user-friendly. So we're going to be utilizing DHS's survey platform that we use, which is called Alchemer. In terms of then what that process is going to kind of look like moving forward, each quarter, all the local tribal and health agencies will receive an email with a link to your quarterly reporting survey form. So you'll utilize this link to access your survey and then report on your activities throughout the year. Each quarter you'll be sent the link. Oh, good. I see in the chat that folks are happy with Alchemer. That's good to see. Yeah, you'll be sent this link every quarter, and Alchemer will save your data from quarter to quarter. So there's no need to re-enter information that you've already shared. And you will have the ability to add or edit what you've already reported. So based on that, each quarter will build on one another. The information that you're sharing with us should reflect the activities that you've completed from the beginning of the year, so January 1st, 2023 through the end of the current quarter. So we have a timeline mapped out just to give one example. So say you're reporting for Q3, it's the end of September. You would report on activities that your agency had completed from the beginning of the year, so January 1st, 2023, all the way through to September. So you'll give the cumulative amount of, say, like trainings that you performed or presentations that you've given. So you'll give us that total number throughout that time period. And then lastly, just to give a little overview of what's going to be coming up, we have a print version that we've created of the quarterly reporting forms that either already have been shared out or will be shared out after this meeting, so that you can see what information we'll be asking for at the end of Q1 and then throughout the rest of the year. And then in March, we're still nailing down the specific date, but prior to first quarter's reporting, we'll be hosting an information session for all local and tribal health agencies, just to go over the basics of using Alchemer and completing your quarterly reporting. We're going to be creating some static resources as well, just that you can use to reference if questions are coming up, some of those frequently asked questions. And then at the end of Q1, closer to the end of Q1, we'll be sending out those individual links so that you all can complete your quarterly reporting. So there's quite a few resources to come, lots of opportunities to ask questions and get support, just because we know this is the process for everybody. I will pause there. I'm also just going to walk through what items we're going to be asking for within the quarterly reporting, but I'll just pause there first and see if there's any general questions about what I just shared. I'll check the chat too. Yeah, I see that there's a question from Chelsea if this document will be sent out to us as well. Yeah, we can definitely add this in to what we're going to be sending out. Any other questions about the transition to Alchemer, what that process looks like? Right. Sounds like none. If there is anything, feel free to pop it in the chat or unmute. I am joining from my phone, and I don't, Maggie doesn't have an Alchemer license. So unfortunately, we can't show you right now what the survey actually looks like. We do have the print version. So just to assure everyone, this is going to look a lot more cleaner and streamlined in Alchemer itself. You won't see all the skip logic written out, but we still just wanted to give you an overview of what the content will be. So the first page just goes over that timeline of when you'll be reporting, what you'll be reporting on, kind of just that quick intro and who you can reach out to for help. And then that second page really just gets into general information. Should we just ask who, which local or tribal health agency you are, specify if you are a GLTC funded tribal agency, add that specifics there. If we don't have you for some reason, you can add your name in. We ask about public health region, and then we ask about current staff working within this project area. I know Maggie mentioned earlier that there's lots of new staff. We just want to make sure that we're including everyone in communications. So that will be helpful for us to stay up to date. And then getting into the next page, we just ask generally about which strategies you've selected this year for adolescent well-being. So you can check more than one here. And then the next page gets into those prevention, promotion, and training activities. This is somewhat similar information to what was collected in REDCap, but with a different framing. Rather than framing our questions around which sites you're implementing them with, we refocused around which mental health, suicide prevention, or anti-bullying curriculums, trainings, prevention, promotion activities you're putting into place and telling us about those. So we ask a series of questions, both, oh, go ahead, Maggie.
No, I was just going to chime in on this one just to call out, like for number 8 specifically. One of the goals this year with the adolescent wellbeing objective, based on feedback from the health departments who were doing this work last year, was to cast a wider net in the programs that health departments could be implementing, in the things that you could be doing at the local level to support mental health, suicide prevention, bullying prevention. And so we listed a number of them here in these checkboxes, but I just want to reiterate that that doesn't mean that you're limited to those. I know some of the counties have their own programming that's been developed locally. There's lots of things out there. We're never going to have an exhaustive list in here, so you can always check the other box. Just wanted to call that out. Thanks, Mary.
Thanks. Yeah, that's really good context. Yeah, and we don't have to go through the specifics of all of this, but basically we ask a series of quantitative, kind of close-ended, and some more open-ended questions so you can share with us about the activities that you've implemented with these various curriculums. We can skip maybe to, let's see, page. Let's see, maybe we can go to support groups and warm lines. So then we asked some questions just generally about if your agency has promoted any support groups and warm lines, and some open-ended questions telling us a little bit more about those. And then our next section, oh, go ahead, Maggie, sorry.
I think I have a lag in the sound. Just to tie this one back to the objectives in GAC, this includes things like PRISM, any other warm line or support group that is being promoted. Some of them I know are listed in GAC, but again, not an exhaustive list.
And then our next section gets into means restriction activities. I don't believe this is a requirement, but if this is something that you've implemented and would like to tell us about it, we wanted to give that opportunity. If you haven't implemented that, that's okay. We just wanted to offer it up as an option. If folks are doing the work, then we know about it and can capture that. Our next section gets into the youth risk behavior survey. It just asks a series of questions around if you've utilized the most recent results, how you've used them, if you've shared them with partners, as well as if you conducted any outreach to encourage local schools to participate. And then just if there's anything else that you'd like to tell us about. So just getting some general information about how you used YRBS and how you've kind of encouraged others to participate in that process. And then we asked some questions about partnerships. Just if you have collaborated with any partners in this year's work to help advance adolescent well-being in your community, and then just ask some general questions about those partnerships and the activities that you have implemented with them. And then we get into facilitators and barriers. We ask these questions just because we want to know what's working, what works well, so that we can help move some of that work forward and maybe provide more resources in that area. And then find out what's been challenging and see if we can help support more in any other way to help address some of those barriers or challenges to the work. And then ask just another open-ended question about kind of like what you're most excited about, what's going really well. So you can share with us successes and specific things that are going on within your own communities. We asked some general questions about health equity in your community. As a Title V program, we're hoping to begin to gather more information about how agencies are incorporating health equity into their work. So these are just some open-ended questions to share about how you might be incorporating health equity or would like to incorporate health equity into your processes. And then this is the area where you'll let us know about the youth engagement toolkit evaluation tool. Let us know how that is going. If you need any support, that will all happen here. And I think Maggie, you're going to be giving some more information about this later. And then these last aspects are really just smaller, quicker things. This just goes into some other GAC requirements of promoting Well Badger and maintaining links to their website. And then further down, we get into just expense reporting, if you're up to date, if you need any support, just so that we can provide any help if needed.
And I'll just pause here because I know that we do have a number of folks who are new and also some folks who weren't doing this last year, I'll say. So just a reminder that for MCH expense reporting, that is not something that should be done annually. Those should be coming in monthly. So those GAC expenses, both expenses and for match, or excuse me, not GAC, CARS, your CARS expense reporting and your CARS match reporting, those should be happening regularly. So we want to see that agencies are able to draw down their funds over the course of the year. And there should not be like one mass report at the end of the year. And then I'll also just throw out there that if you have questions about allowable expenses, or maybe you're trying to determine what should we do with our funding, I'm happy to answer specific questions about that. In general, Title V funding is pretty flexible, and any of your MCH dollars can be used to support your objectives, and the match can be used to support your population. So anything with the MCH population can count towards match, as long as it's not a federal source. Happy to troubleshoot or answer questions about that if folks have them.
Awesome. All right, we're getting to the last couple sections here. So the last one is just if there's any other support or resources that we can provide, and just getting into what those are and how we can help if you do need any support. And then the last one is just if you'd like a copy of your responses. So if you answer yes and put your email in, Alkmaar will automatically send you a copy of what you've put into the survey. So that is it on those. If there's any questions there, please feel free to ask them either in the chat or unmute. And we'll be sending this document out. And then the actual link to the survey will come closer to the end of March. Check the chat. They have more than one person. Yes, yeah. So there will be the ability to have more than one person fill out the quarterly survey. The link will work for everyone at your agency, and we're also going to set it up in a way where you can pause and come back. So you don't have to sit down and report absolutely everything in one sitting. If you want to do a little bit at a time, that's okay. So we're trying to get all those features set up on the back end so that it's as smooth as possible in implementation and getting all this reporting down each quarter. Any other questions? If anything does come up, feel free to put in the chat. I'll put my email in the chat as well. So if any questions are coming up in terms of reporting, you can reach out to me directly and I can provide support. But if there's not anything else, I can hand it back to you, Maggie.
All right, thanks, Mary. Next, we are going to walk through the youth engagement process or youth engagement assessment process for this year. And I want to pause and acknowledge everyone's patience. I know there have been a lot of questions about what this looks like. And I also know that the youth engagement evaluation tool is different than what some of the other MCH objectives are using. So if you are a health department who selected more than one objective this year, you will hear from the other performance measure leads around the assessment requirements for those. They are using the Community Engagement Assessment Tool, or the CEAT, which has been the tool used historically by the MCH team, and that is still required for other objectives. For adolescent well-being this year, we are using a new tool based on feedback from agencies who did use the CEAT specifically to assess youth engagement in past years. So the feedback that we got was that while it was great for assessing community engagement overall, it wasn't specific to how agencies were working with young people as leaders as an organization. So we conducted a review of other possible tools, and let's go back to screen sharing. Okay. And we will be using the Youth Research and Evaluation Exchange tool created, and it's called the Youth Engagement Assessment Tool. This one is linked on our website here, and we can drop this website into the chat shortly. When you click on it, it will launch a PDF. Hopefully you can see the PDF with my screen share here. Yes, perfect. And then this PDF looks really long at first glance, but as you start to click through it, first there's the acknowledgements page, and then you'll see that there are 5 different sections. for organizations who are new to youth engagement. So if your health department doesn't have a youth advisory, if you're not currently working directly with youth as leaders in any capacity, then for year one, the only section that you need to complete is section 1 around organizational readiness. I'm going to scroll to that one first. This is going to walk you through how to use the tool. It is pretty straightforward, and we are not collecting the data from this tool. So the purpose is really for this to be a guide for each individual agency to use to look at how they're working with young people as an agency. And you are going to hold on to this. It's for your purposes only. So the CEAT, again, has different requirements than this tool will. This will be for internal use for your agency. It will walk you through how to use the tool, and then you'll get into the different sections. So the first one being around organizational readiness. There's a rating scale here. And then again, pretty straightforward. It's going to walk you through different indicators. You're going to rank where you're at using their scale up here and make any comments. And also they have a don't know or not applicable section. It'll take you through 12 questions, and then you can stop. So again, if your agency isn't working with youth right now, this is all you have to do is this first section of the tool. If your agency is already working with youth, maybe you have a youth advisory or you have a youth leadership council or something like that that your agency is working with, then we encourage you to complete additional sections. So the next one is youth adult partnerships, youth leadership and decision making, and then youth as evaluators and researchers. And then diversity is section 5. And then the part that we liked the most about this tool is that the appendix makes up the final 10 pages. And the appendix has a lot of examples of different practice changes that your organization could adopt to improve youth engagement. So if you've only completed organizational readiness, you'll find that for each question they asked about, there's a whole number of examples here, like ways that you could include this, different things to consider. And then agencies, after completing the assessment, whether it's section 1 or you decide to do the whole tool, the only thing that you will report to DHS in the Alchemer process that Mary just outlined is going to be what your identified practice change was for the year and your progress towards that goal. So I'm hoping that this is less reporting for everyone and also still a useful guide to improving youth engagement and youth assessment, or youth engagement and youth leadership at the local level. I will say too, I am very open to feedback on the process this year, knowing that this is new. We are here to answer questions. The extension team is fantastic if you're looking to develop those plans, like for how to improve moving forward. I would encourage you to reach out to them. And I'm happy to take questions if folks have them right now as well.
Thanks, Maggie.
Yes, thank you. Questions come up, feel free to ask them later on as well. Thanks, everyone.
Great, so we're going to do a little bit of an overview of helping you get to know Extension. Some of you may be very familiar with Extension and some of you may not be familiar. And as I'm starting this, Jake is also going to put a demographic form back into the chat box in case you joined late. If you would take just a few minutes to fill that out, we'd greatly appreciate that. So a little bit about Extension. Extension is part of the University of Wisconsin-Madison. It's a division of UW-Madison, and we provide affirmative action and equal opportunities in education, programming, and employment for all qualified persons, regardless of their race, color, gender, creed, disability, religion, national origin, ancestry, age, sexual orientation, pregnancy, marital, parental, arrest or conviction record, or veteran status. And our mission really embodies the Wisconsin idea by partnering to develop and connect the research and educational resources of UW-Madison with residents and communities throughout the state to help address local, statewide, and national issues. And all of UW-Madison's extension work is guided by the Wisconsin idea, the university's commitment to public service that is rooted in the principle that education should influence people's lives beyond the boundaries of the classroom. Extension has deep local ties that develop regional and statewide networks that are able to respond to emerging issues. We work in and with communities, which allows Extension to connect our research and resources directly to those affected populations and areas. We have county extension offices located in 71 counties and 3 tribal nations. Educators live in the communities and understand the local issues and needs. Our programming is organized into 2 divisions. We have the Division of Agriculture, Resources and Community Development, Natural Resources and Community Development, and then we have Youth, Family, and Health. And then within each of these divisions, we have programming that's organized into institutes that educators are affiliated with based on their program focus and the needs of the communities that they serve. As you may guess, the 3 institutes in the Youth, Family, and Health Division are the ones that most closely align with the programming that's related to adolescent well-being. So we're going to take just a closer look at each of those, a broad overview, not getting into lots of detail about each of them. The first would be the Health and Wellbeing Institute, which really works to catalyze positive change in Wisconsin families through evidence-based programs focused on nutrition, food security, food safety, chronic disease prevention, mental health, and substance misuse. We have roots in both urban and rural communities where we're working together to help solve the state's most pressing well-being needs and to ensure that Wisconsinites live stronger, healthier lives. Another institute on that youth family side is that of human development and relationships. And so we know that strong family relationships and finances are the building blocks of our communities. And again, we have educators located throughout the state that are part of this institute. And again, the programming that most closely relates to adolescent well-being would be the family engagement and relationship programming in this institute. The third institute where programming aligns with this work is the Positive Youth Development Institute. And in a few minutes, you're going to have a chance to hear some examples from a few of our educators about their programming in a few of these institutes. So we have identified a core group of county-based extension educators from throughout the state that are going to provide support in counties where we don't have existing extension staff that can do this in addition to their own county area. And I'm just going to allow a few minutes for them to introduce themselves and share a little bit about their programming related to adolescent well-being. And I know I saw Sharon Krause was on. So Sharon, if you would like to introduce yourself to the group.
Yes, hello, Sharon Krause, and I'm a community development educator for youth. I work half-time in Oneida County and half-time in Lac du Flambeau, and I'm helping with this group because I run 2 Raise Your Voice clubs at high schools in the area. I also am on a number of coalitions in both Oneida County and the Lac du Flambeau tribe. Thank you.
Sorry about that. I muted myself and can't get unmuted. All right, Taylor, I saw that you were on. Would you like to introduce yourself as well?
Sure. Hi, everybody. My name is Taylor, and I'm a youth educator within the Positive Youth Development Institute here in Dane County. My background is in public health and the arts, and my research really focuses on youth as key stakeholders within public health initiatives, as well as the intersections of arts and public health, really focusing on how the arts contribute to things like health communication, healthy community design, and building resiliency in youth to address ACEs. But my work within adolescent well-being within Extension, one of the programs I run is called By Youth for Youth, which focuses on civic engagement and leadership. And high school youth here in Dane County receive about $20,000 to $30,000 from the county, and they deliberate and distribute the funding to youth grant applications. And applications range from mental health initiatives, after-school clubs, immigration support, climate change, and youth homelessness. Other things that I do revolve around creative placemaking. For example, there's the Fitchburg Teen Center, which is a community development project with teens, where we work together to understand how our built environments contribute to health, but in particular, how a youth design space like a teen center contributes to their health. And then finally, youth outreach or youth health outreach. So I am a part of a local coalition with the public health department, and we work with local teens who are currently in the middle of designing their action plan and community impact projects surrounding tobacco prevention among youth. And again, really just focusing on youth designed, youth-led projects. Thanks.
Thanks, Taylor. And a couple of our team members weren't able to be with us today. So Mary Metten is the health and wellbeing educator in Kenosha County. And again, a little bit about Mary. She facilitates youth mental health first aid, supporting youth mental health, learning to breathe, and is a part of the wave 3 of the Well Connected Communities grant, where she's facilitating the youth advocates for community health process. And then Sheila Michaels, again, is a health and wellbeing educator in Adams County, and her programming focuses primarily on social and emotional and mental well-being and substance use prevention. Some of her work includes partnering with a local nonprofit to run the teen outreach program at the local middle school, which builds social, emotional, and life skills and has a strong focus on community service learning. Working with her colleagues to lead a team of youth in the middle school's after-school program through the Youth Advocates for Community Health program. She also co-leads their local substance use prevention coalition, Drug Free Adams County, and teaches adult and youth mental health first aid, supporting youth mental health for Extension volunteers, and is trained in the Learning to Breathe program. So that's a little bit about our core group of county-based Extension educators. And then we are excited to share with you a new tool that we have, and I'm gonna, Christina can give me screen sharing. All right.
Sorry about that.
Yeah, no problem. Great. So hopefully everyone is seeing my screen. Are you seeing my screen? Not the right one though, I don't think. All right. So are you seeing the screen that says Title V Maternal and Child Health Grant Adolescent Wellbeing? All right, awesome. So this is a new mapping tool that we have created. We were trying to figure out a way to show what health departments are working in this area, and then what areas we have extension staff in. So again, the front page of this, the home page, is just kind of some definitions. And hopefully as I click, it's going to go to the map. Whoop. Okay, is everyone seeing the map now? Okay, thank you, Christina. All right, so what you're seeing on this particular page is you're seeing all of the health departments and all of the extension presence mapped out on the state. The little orange dots are for those health departments that are not a county-based health department. So we tried to figure out a way to map them, those departments on the map as well. And then as I click, you can do, there's a drop-down menu. So I can click on what health departments are working on the strategy of collaborating with local schools. So if I click there, the map is going to change and you can see which health departments are focused on that particular strategy. And then you can do the same for the coordinate and facilitate skill-based gatekeeper training. Again, that is the one where the majority of health departments have chosen that strategy. And then the third strategy is the promote zero suicide. And again, there's only a couple of health departments that chose to work on that strategy. The other thing that you can map out here is those extension educators that are located in counties. So you will see here are where health and well-being educators are located throughout the state. Here's where we have human development and relationships staff members. And then here is where we have community youth development program educators throughout the state. So again, just different ways to visually see who's involved in the project. And again, we can add additional layers to this map as we continue, but wanted to share with you a new tool that we have created. And if anyone has any feedback on that tool, we will be sharing that tool with you so that you will also have access to it. Great. And I'll turn it over to Jen.
All right, thank you, Debbie. I'm excited to see how people can use that tool to help with their objectives. We're gonna launch a bit of a poll right now. What best describes your department's engagement with youth right now? If you could just pick one of them. We do not engage with youth at all. We ask young people for their opinions and insights as we make decisions and sometimes do them. Young people are involved with initiatives and decisions are made in partnership with adults. So we're just going to give everybody a minute or two to fill that out. And as we're waiting for it to be completed, Maggie offered a really great tool earlier that can help you assess what your engagement with young people looks like within your department and some of your programs. So do you want to go ahead and share the poll, Jake?
Yes, the poll is launched. We are just waiting on 18 more people to respond.
Okay, thank you, Jake. So we have quite a few different answers on here, or I guess different answers to the question on here. About 46% of health departments that are working currently on these initiatives aren't engaging with youth yet. 43% ask youth for their opinions and insights, and 11% are involved with initiatives and decisions that are made in partnership with adults. We really wanted to know what your engagement looks like so that we can provide you with the best resources that we have within our state, within Extension. You heard from a couple different educators that are working on some really great initiatives, and we love to get you partnered up with them for some of the work as we're moving forward. So as we talk about youth engagement, we are often saying, like, why is youth voice and authentic youth engagement really important when we're creating or implementing these public health strategies in our plan? And part of it is because when you look at the data, the 2021 census data, you'll see that 21.6% of our youth in Wisconsin in between ages 5 and 18 years old and that's like a very large number. 21.6% of the people within our state are between 5 and 18. So that's a really significant number. And we just really often forget that young people are experts in their own lives. And the best outcomes happen really when they're fully engaged in partnership in some of these decision-making efforts. So it really builds on individual leadership and skills, strengthens meaningful relationships, and leads to effective solution. Youth really do have the skills and abilities to understand public health issues that are going on in your community and really be great partners in change agents. They just might need some more tools and support to do so. Since this is an adolescent wellbeing initiative, all of through MCH, what you picked, it's important for communities to embrace your youth leaders and work together to engage them authentically. We do have a question in the chat. Yes, all of the links will be sent out for follow-up so that you guys have them later today. All right, so we're talking about authentic youth engagement, right? So what does that really look like? It can best be described by focusing on the experience that young people have when they're engaged. Do they feel valued, respected, and trusted? They feel that they're working in an environment that facilitates their engagement. And then they're involved in that in a meaningful way as teachers as well as students. Their voices are being heard and treating it as worthwhile. They're given opportunities to be involved in that decision making and gain leadership skills and have their ideas realized. They're able to participate in the social aspect of their involvement. You know, youth are very social, as are some of us adults. They see change and progress happening as a result of their contribution, and they can help generate to see what the problem is, help with doing that assessment, and they can also help with coming up with a solution. So within Extension, we have some really great success stories that highlight some of the outcomes that can come out of really involving young people in your plans. So in Manitowoc County, I don't know if any of y'all are working up there and know Laura Appleback. She is really a model for authentic youth engagement. And she's worked with community partners to work with a group, and they've been meeting, I think, for the past 5 or 6 years. So today we're going to focus on one of their successes, which was their school smoothie project. So this amazing group of young people, they were able to get smoothies put on their lunch menu twice a week as a reimbursable meal, walking through Extension's Youth Advocates for Community Health model. So they created a strategic plan. The youth themselves, they did in some surveys. They worked collaboratively with school administration, teachers. They reached out with their food service, and they worked with DPI to see what requirements they had to meet, everything that had to be involved. And then they wrote for a grant to be able to help with some of the tools that they would need to make that possible. And in the end, they came up with that policy, systems, and environmental change that changed what their school environment looked like. If anybody is in Marquette County, Krista Van Treek is in Montello, and she leads a group of young people. They're still meeting as well to help community members be active and outside. The youth plans to paint 2 creative crosswalks near Montello School, and they are still there. They're really beautiful and bright. The creative crosswalks are normal road crossings that are also like artistic. They can look like what's on the screen. Some communities have done pianos or keyboards or zippers. They really worked with their city council very closely, their public health department, and they were also supported by their school staff, working through this project to get this environmental change in their community. It's still there today, and they're still working with the city on upkeep and what that looks like. So we want to hear from you. We want these spaces to be really as useful as possible. So we're going to launch one more poll here. And we'd like you to pick the top 4 topics that you would like to engage with other health departments and colleagues in these learning community calls. And if you have any other ideas, we had a short answer, but the option wasn't there. Please put those other options in the chat.
We should also mention that the poll is anonymous, correct? So
yes,
just in case anyone was concerned about that.
Thank you, Danette. We have a lot of options up here, so we're going to give you a minute to make your choices. You're able to pick the top 4. All right. Thank you for participating in that. We can share the results just so that you all can see what your colleagues are thinking. We have I think the largest was around youth engagement, and then behavioral health resources, and effective coalition work, health equity or health disparities. All of these are different issues that Extension has colleagues that are going to be seen as experts within their community around. So we're going to take this information and really use it to plan our sessions moving forward. I am going to pass it over now. Oh, actually, I'm going to finish talking about some data points. Sorry, Debbie, it was me. So on our next slide here, we have a couple of different resources that are available. I know that many of you probably work closely and look at the county health rankings, but within that, a lot of people forget that a piece that's overlooked is the what works for you section. Jake's going to put a link to it in the chat, but that offers policies, programs, as well as their evidence ranking based on whatever strategies that you pick out. You can see some on the screen over here. So if you don't see a topic link that's in the area that's defined by strategies, you can just put in a keyword. If you put in mental health, it'll come up with a bunch of different policies and programs around mental health that you can use. And of course, their evidence rating. There's one other on the left. We wanted to share the recently released Congressional District Health Dashboard that may be an interesting tool for some of your work. So the goal with the site is to provide policymakers, advocates, community members with an array of actionable and nonpartisan data at the congressional district level. So they talk about life expectancy, diabetes rates, the uninsured, children in poverty. They really try to demonstrate the strengths and challenges in the different regions and drive positive change at the district, state, and national level. So if you are ever having some of those conversations, it's really great to go in there and look around and see what this tool has for you that you may be able to use. All right, now I'm going to pass it over to Debbie.
Thanks, John. All right, so as our time today is coming to a close, we wanted to share a couple of upcoming training opportunities that we are aware of. First, we wanted to talk about our youth mental health first aid trainings that Extension is offering. These trainings are designed to teach parents, family members, caregivers, teachers, school staff, any adult really who wants to learn how to help an adolescent who is experiencing a mental health or addiction challenge or is in crisis. And again, Extension is offering these trainings on a regular basis through a grant that we've received from SAMHSA. And you can find more information about the trainings on the Wisconsin Rose website. And Jake is going to put that in the chat box for you so that you have information about this. The current flyer that I have up on the chart is just the top half of the one for January through March. We will be having another set of offerings coming up in the next quarter. So we'll have a new flyer with those dates on as well. But if you go to the website, you can actually find the information as well, and we'll share the flyer as soon as we have the new one ready to go. Another training that is coming up is, you heard Sharon talk about Raise Your Voice Clubs. Which is a student-led club that focuses on raising mental health awareness, empowering students, and promoting mental health resources, developing advocates and leaders, and creating an overall greater dialogue for mental health and wellness. And again, Raise Your Voice is a project of NAMI, Wisconsin. And so we have had a great deal of interest from schools and other youth organizations about starting Raise Your Voice clubs in those settings. And so we are offering some trainings coming up for new advisors or those who are just interested in exploring that opportunity. And you can find more information at the NAMI Wisconsin website. And we can also send this flyer out as well when we send the follow-up email about following this call. But again, that it will be a virtual webinar training on April 4th and May 11th. So again, you don't need to attend both. Both of them will be the same. We're just offering one in the morning and one in the afternoon at the end of the day. And then finally, another training that we know is somewhat maybe of interest to health departments is the QPR, or Question, Persuade, and Refer training. And Heidi Pritzel with Aspirus here in the northern part of the state is offering an instructor training virtually on April 21st. And she does have a few spots available for this training. And she did indicate that if this one fills up, she's willing to schedule additional trainings. So again, if QPR is something that you are interested in, she is willing to offer those trainings. Does anyone else have any trainings related to adolescent well-being that you would like to share?
Debbie, I have one that landed in my inbox even this morning, not a training so much as just making folks aware about the school-based mental health grant. I will put a link in the chat so folks have that.
Awesome. Thank you, Maggie.
There was a question in the chat about fees associated. There may be fees associated, and when we send out the links and the flyers, we'll make sure that we include that on those.
Yes. Thanks for catching that, Tim. Great. As a method to share information between our calls, we're currently planning to do a monthly newsletter to share updates, resources, training opportunities, and new research. And we'd also like to include in that newsletter a section to highlight your efforts. So if you have things to share, please send them to that same email that we provided earlier for questions or requests. And again, that will be in the chat box. We'll also include that in the information we send. But again, that is our plan, is to try to create this in-between resource sharing, but do it in like one newsletter type versus several messages a day coming to you. So we'll kind of collect things and share that with you monthly. We're also in the process of developing a website where we'll be able to keep these resources as they're being developed and put into a website that you'll be able to access. And we'll also probably have the recordings of the calls, learning community calls on that website as well. Any questions about kind of that resource sharing or anything anyone has thought of that they'd like to share? So before we wrap up and close for today, we wanted to get some feedback from you about today's call. So you see on the screen, there's a QR code that if you can go to that, it's a Qualtrics survey to ask for some feedback about today's call. Jake is also going to put the link if you're unable to use a QR code in the chat box. And if you could, we're going to give you about 3-4 minutes to complete this brief evaluation around this session. Now we know that everyone gets busy and you have good intentions to do it after the call. But we're going to try to build in some time for you to do that here to give us some feedback about today's call. And we'll gather back together for any questions that anyone has in closing. You can continue to use the chat box as well. I don't know, Christina, if you have some music that you could cue up, that would be great.
That is a great idea. Let me pull it up. You guys hear that?
I say I'm too late. Got nothing in my brain. That's what people say. That's what people say. I go on too many dates, but I
As people are finishing up the evaluation or the feedback, if you have any questions, feel free to stay on for any closing questions that you might have, or put them in the chat box. But if not, we will give you a gift of time of a few minutes, because I know everyone is busy.
Christina, do you want to go to the last slide quickly? That these will be our future learning community calls, just to update you. I know that you got them all sent out. They're all going to be from 12 to 1:30.
Thank you all for attending today.
Have a great day.